Hi, so in this lecture we are going to discuss the volume of distribution and the term apparent volume of distribution or VD. Now I'm sure that those who already have some idea of this topic are mostly confused when they read about this concept. What is drug distribution? What is apparent volume of distribution or VD? How to calculate VD? I will try to find out the relationship between VD and elimination rate constant or KE. We'll also look for the relationship between drug clearance and its half-life or T-half. We will also discuss compartments of the body, or technically we call it compartment modeling. And of course, in the end, we would discuss some factors which affect VD. Now, in order to understand the overall concept, let's see what is drug distribution first. The drug distribution refers to the movement of drug to and from the blood and various tissues of the body, the tissues such as fat, muscle, and brain tissue, and it also represents the relative proportions of the drug in different body tissues. And it is a reversible process, of course. Now, almost the same principles that govern the drug absorption, for example, ionization of a drug, lipophilicity of a drug, size of the drug molecule, pH of the environment, and drug-protein binding, etc., also govern the rate and extent that a drug will distribute to the various tissues in the body. So let's jump straight into our today's topic, apparent volume of distribution, or VD. So VD is apparent volume. Yes, I repeat, apparent volume, not the real volume, into which the drug appears to be distributed. As you know, some 60% of human body is water, so you have water everywhere. There is water in your plasma, you have water outside the cells, you have water inside of the cells. Now the volume of distribution is basically the volume of body water into which the drug is distributed. In other words, it is not the amount of drug, or it is not mgs or milligrams of a drug in your body. Or we may say that this concept is about the volumes and not about the weight or mass of a drug. So for example, if you take a drug orally, it could either be present in your plasma, it can surely go into the extravascular spaces or the extracellular spaces, or interstitium, or it may go into your cells, which all contain water. So apparent volume of distribution is basically the distribution of a drug into body fluids or the water of the body. Yes, and please don't panic at this stage. So VD does not represent a physiological value, as it is a purely theoretical volume, which only gives information on a drug's distribution in different biological fluids. Or apparent volume of distribution is a purely pharmacokinetic concept, which gives us idea about the distribution of a drug in the body. VD is one of the most misunderstood pharmacokinetic parameters. The basic purpose of this video is to address the fundamentals of this topic and understand the real meaning behind this concept. So as I've just said, VD does not represent a real volume, or let me say, apparent volume of distribution predicts how extensively a drug is distributed throughout the body. The apparent volume of distribution, or VD, is mathematically calculated by dividing the dose that is administered in milligram by the plasma concentration of that drug in milligram per liter, or VD is equal to D over Cp, where D is the amount of drug in milligram in the body at a particular time, and Cp is the plasma drug concentration in milligram per liter. To make things easier for you, I will break down some of the common questions I get about this topic. I'm pretty sure that I would be able to walk you through them. More importantly, if you have the slightest of backgrounds of pharmacokinetics, you will be able to grasp the concept of VD rather easily. So let's get started. For example, a total dose of 10 mg is administered to an individual. If the plasma concentration of the free drug at that time is 5 mg, what will be the VD? So as we know that VD is equal to D over Cp, or in other words, VD is equal to dose of the administered drug, which is 10 mg here, over concentration of free drug in the plasma, which is 5 mg. And we are asked to calculate the apparent volume of distribution, or VD. So in order to understand this question, let me draw your attention to this illustration. As you have seen that the dose given is 10 mg and the fraction of free drug is 5 mg. So let's assume this is a blood vessel, and as you know, there are plasma proteins such as albumin and alpha-1 acid glycoprotein in the plasma, which can reversibly bind to the drug molecules and can alter the pharmacokinetics of a drug. Here the blue dots represent the drug and the larger red ones represent the plasma proteins. If you look here, you can see that some of the molecules are free in the plasma, whereas some are bound to the plasma proteins. Well, acidic drugs and neutral drugs bind to albumin, and basic drugs bind to alpha-1 acid glycoproteins. So let's, for example, here, this 1, 2, 3, 4, and 5 are the free drug molecules. You also know that only the free drug, for example shown here, and the lipophilic form of the drug can diffuse from the intravascular space to the extravascular space, which will then enter into different body tissues across the cell membrane. So let's remind ourselves a very basic science concept that concentration is equal to mass over volume. This concentration here is our Cp. So Cp is equal to 5 mg over 5 liter. Now this 5 mg is the amount of the concentration of free drug. Now where this 5 liter comes from? 5 liter is the volume of blood in a healthy individual. Yes, of course, from your basic physiology knowledge. So let's put these values into the equation. So 10 mg, which is the dose, over 5 mg by 5 liter, which comes from here, which is our Cp. This would cancel out, and the answer we get is 10 liter. Which is very confusing. As you can see, it is 10 liter. The total volume of the blood is 5 liter. So it's the double volume to that of the total blood volume. Or we can say it's a large VD, larger than the total volume of the blood. And this is where the term apparent was used for this concept. So we'll further explain this towards the end of this lecture, that why this is so large. It could be even larger than this volume in some cases. So let's solve another question. Here the statement is, determine the volume of distribution, or VD, of a drug with a total dose of 3000 mg and a plasma concentration of 400 mg per liter. So this is quite straightforward. We have the formula, VD is equal to dose over plasma concentration. So the D here is 3000 mg CP is 400 milligram per liter. So let's put the values. This will cancel out. And the VD in this case is 7.5 liters. So here I will introduce you to another formula which will relate VD to the elimination rate constant, or KE. Now, elimination rate constant is another pharmacokinetic parameter. So let's explain it with an example or a question. A 3000 milligram dose with a concentration of 600 milligram per liter has a clearance of 0.07 liter per hour. What is the elimination rate constant? So here D is equal to 3000 milligram. Cp, the plasma concentration of the drug mentioned here, is 600 milligram per liter, while the clearance is 0.07 or 0.07 liter per hour. And we are asked to determine the elimination rate constant, or Ke. So here is that another formula which relates Vd to the elimination rate constant and clearance of the drug. Let's call it equation 1. And we have just done some calculations on the basis of this formula. We call it equation 2. Vd is equal to D over Cp. I'm sure you're quite familiar with that. So this is our equation 1. This is our equation 2. So let's combine equation 1 and 2. Becomes D over Cp, which is equal to clearance over Ke. Clearance over Ke. Let's put the values. D is 3000 over 600. Now the 600 is our Cp. 0.07 is the clearance in liters per hour, and we are asked to calculate Ke, the elimination rate constant for this drug. So with the cross multiplication, we get this, or Ke is equal to 0.014 hour. So with this formula, with these two formulas, we can calculate the elimination rate constant of a drug. Yes, so here we relate the drug clearance to its half-life. So we have a formula which will relate the drug clearance and the half-life of a drug. Let's explain it further. We have a question to calculate the half-life, or T-half, of the drug from the previous data. The data that we have just shown in the last slide. So T-half is equal to 0.693 over Ke. That is the formula where you relate T-half to the elimination rate constant. So if you have the value for the elimination rate constant, which we have just calculated, and we put into this equation, we get the half-life of that drug. So putting the values, 0.693 over Ke, and Ke was 0.014 hours. So we get 49.5 hours. So the half-life is quite long. The 49.5 hours for a drug is quite long. Well, let's see what is half-life. Half-life of a drug is the time taken for the plasma concentration of a drug to reduce to half or 50% of its original concentration. So let's approach this topic, or the drug distribution, in a different way. Let's see how the body is divided into different compartments, and this is also called the compartment modeling. So of course, the human body is not a glass or a beaker. Drug is distributing in and out of many tissue compartments while it is simultaneously being eliminated. This complex and continually changing environment must be simplified in order to mathematically model the human body. Therefore, The body is usually divided into two spaces, or two compartments. A central compartment, which consists of blood vessels and highly perfused tissues. Highly perfused means where the blood supply is large, for example, liver, kidney, etc. And the peripheral space or the peripheral compartment, which consists of all tissue spaces outside the central compartment, which are less perfused with a less blood supply, for example, skin and adipose tissue. Now we will explain this by taking an example of two compartment models, the central compartment and the peripheral compartment. Let's discuss this in a purely pharmacokinetic way. For example, if the drug is taken by oral route, it will get absorbed from the GI tract into the central compartment or the bloodstream with an absorption rate constant Ka. From the central compartment or the bloodstream, it will be distributed into the peripheral compartment or the tissue compartment with a distribution rate constant K1 to 2. We call central compartment as compartment 1 and peripheral compartment as compartment 2. Therefore K1 to 2 and K2 to 1. So from the peripheral compartment, the drug will redistribute back into the central compartment with a redistribution rate constant K2 to 1. Now in case of IV bolus, the entire dose is placed into the central compartment or the bloodstream. Therefore, it has 100% bioavailability. Now elimination is generally depicted as occurring directly and exclusively from the central compartment with an elimination rate constant Ke. The two-compartment model display first-order kinetics where the movement of drug from various compartments depends upon the concentration of the drug. Now one thing which I forgot to mention is that elimination phase is the longer phase because the drug must first diffuse from the peripheral compartment into the central compartment and then it will be eliminated. So it takes a longer time. That's why it's a longer phase. So the drugs that have relatively small VD, for example 5 liters, would largely stay in the intravascular compartment. Drugs with intermediate VD, from 12 to 20 liters, would distribute throughout vascular and extravascular compartments, whereas drugs with large VD, that is greater than 40 liters, would distribute throughout all body tissues including vascular, extravascular, and intracellular or tissue site or the tissue compartment. Let's explain this in a more practical way. So the total body water is 0.5 to 0.7 liter per kilogram of the body weight, or in other words, it is 35 to 49 liters in a 70 kilogram individual. Let's take the example of digoxin. So digoxin VD is 500 liter, which is quite large, and it's greater than total body water, which is quite amazing. Now, digoxin is used in several cardiac pathologies such as atrial fibrillation and heart failure. Why digoxin has a very large volume of distribution? So the answer is that the digoxin's volume of distribution exceeds the total body water due to its high affinity for the skeletal and cardiac muscles, intestines, and kidney, which clearly indicates that digoxin is extensively distributed in various body tissues as reflected by the large volume of distribution. So the high concentrations of digoxin are found in the heart, myocardium, and the kidneys, but the skeletal muscles form the largest digoxin storage. To sum up the matter, I would say that because a drug is often sequestered or concentrated in certain tissues, The volume of distribution of a drug such as digoxin may be much larger than the volume of total body water. I'll again repeat that the volume of distribution is a mathematical concept which does not necessarily reflect a physiological or real distribution space. Discuss some factors which affect VD. For example, blood flow. So drugs will be more quickly distributed to areas of the body that receive larger amounts of blood flow, for example, heart, kidneys, than to the areas that receive little blood flow, for example, skin and adipose tissue, which we represent here as peripheral compartment. So once a drug reaches a peripheral compartment, for example, adipose tissue, it may remain distributed here for quite a while until the plasma concentration of that drug decline and the drug can move down its concentration gradient back into the bloodstream, which we call redistribution. So the next factor is lipophilicity. As you know, that generally the lipophilic molecules are more likely to pass through the lipid bilayers and therefore more likely to leave the bloodstream or the central compartment and distribute to areas with lipid density, for example, peripheral compartments or the adipose tissue, and therefore they have a larger VD. On the other hand, drugs which are water-soluble or hydrophilic in nature are confined intravascularly, or they have a small volume of distribution because they are largely present in the central compartment, are present intravascularly, as I said. So the third factor which affects VD is plasma protein binding. So plasma protein binding of drugs decreases the apparent volume of distribution. The plasma protein binding occurs intravascularly or within the blood vessel or in the central compartment. So drugs that are highly protein bound here tend to stay within the vascular space and they do not distribute. So mostly acidic drugs bind to albumins, whereas the basic drugs would bind to alpha-1 acid glycoproteins, lipoproteins, and globulins. And of course, the VD may be influenced by the disease states, for example, chronic liver disease. So the patients with chronic liver disease have lower serum albumin concentrations. In other words, the normal or the natural binding of acidic drugs to albumins in the central compartment or within the blood vessels can be affected. Now, the plasma protein binding of acidic drugs would be reduced in such a condition, leading to lower plasma drug concentrations and higher VD values. So the drugs will be extensively distributed into the peripheral compartments rather than staying in the central compartment because of the inadequacy of the albumin. So you may be thinking as to why the liver disease would cause low levels of albumin. The answer is the albumin is manufactured in the liver. So a liver disease will lead to hypoalbuminuria or low plasma albumin levels. Now, low plasma albumin levels will affect the binding of the acidic drugs to these protein molecules, and this in turn could lead to the alteration in the distribution of these acidic drugs in the body. So our topic ends here. I will see you around in the next lecture with a new topic.